Let's get started. So I'm Yudira. My training was neurology, so medical school, then neurology, then clinical neurophysiology. And then I have had FND, not FND, but functional symptoms myself since medical school. So professional development along with personal wellness understanding. And okay, so you'll read my disclosures later. If you have any questions, you can let me know. And so what are you here? What am I offering? What are we going to be talking about? What is this experiential education? So as you and me, we have had this patient population, uh, interacting with them, trying to help them, and then they do not improve to our liking and to their liking. So what do? We start researching, researching, okay, why is this happening? Trying to understand the problem, the disease, why is this happening? And we always, as a good healer, as a good problem solver, we try to target the disease at the root cause. So what we're going to learn here is founded in pathophysiology. So the science that studies the mechanisms of disease production and maintenance, and also some clinical research. So we're going to be, everything that I'm going to be sharing is coming from multiple fields, from neuroscience to somatic experiencing to CBT to existentialism to psychedelic medicines. Like I have backgrounds in all these. So we'll be targeting the root cause and learning about mechanisms of disease from those various perspectives. So it's pretty comprehensive. We're going to be talking about the theory and we're going to be trying to experience it in our bodies and then seeing the case demonstrations. And so this is education for patients, for families, and for professionals from all types, and for the healthy public who want to prevent and FND, functional illnesses in ourselves, who want to help others, because it's very common. And with the community, we need to help one another. So why are we here? Oh, because we want to test and see if this work, try it in practice. We want to criticize this, celebrate it, and maybe, depending on our conclusions, we can collaborate, unite forces. You know, what you're doing, what I'm doing, maybe do research and grow professionally. We don't know where this is going to take us, but this is where we're aiming for. Use, and I'm going to send you this paper, which is the summary, is the history of the science in FND and what are the things that we need to do from here onwards to solve the problem, to help our clients, to help the community, to live better ourselves. So the questions that we have when we want to help people, what is FND? How frequent is this? Is it worth my time and my training? Is it worth for me to excel at this? What are the treatments? Are my patients getting better, in remission? Is it resolved? Do I want to get them cured? Do I want to achieve the maximum potential? So many questions in the background of our mind that we're going to try to solve. So what is FND? Well, we're not only talking about functional neurological disorders, but we're talking about the whole umbrella of functional disorders. So we have FND, but we also have diseases from other organs and systems and other specialties, like irritable bowel syndrome, like chronic fatigue syndrome, fibromyalgia. So other areas besides the nervous system, besides all the nervous system manifestations that are many and all, because the nervous system controls everything we do. And I think besides all the neurological manifestations, then we also have the other specialties, the other human beings that are involved. So we, by gaining knowledge, we can influence not only our patients, but we can influence the larger healthcare system because they all need to learn what we're going to be learning. They should all learn this. Maybe you agree, maybe you disagree, but let's see. Because through helping other healthcare professionals, through helping one another, we ultimately help patients and the community. Drain is spreading through social media. It's expensive. You're going to get this to read it. And then there is a lot of data from 4 months ago from the Functional Neurological Disorder Society International meeting that many diseases are appearing, like long COVID, migraine, autism, and ADHD are now considering functional illnesses. Through TikTok, there has been now new variants of FND that are caused and spread through TikTok and social media. So this keeps increasing and becoming more frequent. And that could even affect us and has affected us. So we ask, okay, what are the treatments? I want to get better. I don't want to get this again. I want people around me to help better. I want to make a career out of this. I want to feel empowered and a healer and contribute to society. So the treatments that have been researched, approved by insurance, the ones that doctors are prescribing and that patients are getting and the community is getting are basically two: CBT and the body-oriented therapies, which have physical therapy for the body, occupational for the hands, speech and language for this area. So basically two treatments: body-oriented, divided in various sections of the body, and cognitively oriented. What are the outcomes and prognosis? Are those treatments helping? This is in the paper that I will be sending. So all the papers that you read, it tells you that still the outcomes are suboptimal. Patients are not recovering. They are not achieving remission. They are not recovering to the degree they wish. They are not getting cured, and they are not achieving remission. On the other hand, high relapse rate. We know the blue arrow, we know that physical therapy helps, psychiatric assessment, psychological, psychophysiological, somatization, management, giving attention to the body, somatization, management, education, close follow-up, multidisciplinary care, all that helps. But there are many things about CBT, PT, and the current state of treatments that are not being helpful. So there is stuff that we still have to do. And what's the problem with CBT and PT is that they target mainly cognition. So emotional processes and sensory motor processes of the body, the voluntary responses and stress physiology is not being comprehensively targeted. This is why the disease continues to be affecting patients. So we're going to learn a lot about pathophysiology, clinical research with the goal to target the root cause in real life in the patients that you talk to in your own body. And this is all through scientifically explained techniques. And we're going to learn to provide neuroplasticity exercises because it's a problem with functioning of the nervous system. So neuroplasticity has a role here. So the causes, we know that it's very common and derived from the commonest challenges, stressors, traumatic events, adversities in real life. So all these various situations, changing houses, changing jobs, undergoing a physical injury, all these common challenges and problems in life can affect adults, children, and even when they are in the mother's womb, the nervous system starts receiving these triggers that dysregulate the nervous system energy. We know it's very common, more and more conditions, and all healthcare professionals can be involved. So the other situation, the other problem that we're having in society and that we will have to intervene is that there are no preventive strategies. So when we have many modern risk factors and when we have no prevention strategies, it's a recipe for a pandemic, for a disease that is very prevalent all over the world. And this is what's happening, and a disease that is spreading through social factors and social learning and social media. So this is not highly recognized, but it seems to be a pandemic because it's prevalent in all modern countries. So what are we going to do about it? Again, we're going to learn through experiential education about the mechanisms of disease production and maintenance. We're going to do so over the 5 weeks, and today we are going to look at the foundational model of the next classes, which is this. It's going to be in your slide. This is the initial model that I published in a paper last year. I will call this an abbreviated and the first version, but the model that we're going to be learning over the past year has gotten a little bit more comprehensive and complex because over the past 2 years, research has been done and more theories explaining. There's actually a lot of evidence talking about the cause and the mechanisms of disease production. So we have a lot of evidence to target the disease at its root, and this is what we're going to be doing, working with this model. And again, when you look at the model that I will explain in a moment briefly, physical therapy and cognitive behavioral therapy target the neocortex and the soma, the physical body. So the limbic emotional network and the autonomic network is largely untouched. So we're going to learn about them all and target them in an integrated, interconnected, holistic manner. So mind, body, emotions, everything in the environment. This is what they call the biopsychosocial spiritual model, which is an acquired disease that comes from the environment. So today we briefly are going to talk about the environmental factors, these 5 boxes. The next 4 weeks, we're going to talk about the abnormal processes inside the brain, abnormal processes in the neocortex, in the soma, in the autonomic nervous system, and in the limbic system. We're going to feel them in our own bodies. We're going to learn to assess them and target them in our bodies and in our clients. But it's important to always look at those processes in relationship with the environment, because things and triggers that happen since the prenatal period may come up. And stressors from modern life, but also things from childhood and attachment theories, for example, that shape the limbic network, the emotional network, through the relationship with our parental figures and caregivers. Stuff about the environment around social learning, social conditioning, and hypnotic suggestions coming from the environment may affect us, that are perpetuating social factors. So the environment will always be interplaying since the prenatal period to the present moment and even the future, because everyone has dreams of a future life that they want to achieve in the environment. So the environment from past to present to future will always be interplaying with the internal experience of mind, body, emotions, autonomic nervous system. Okay, so to keep it simple, because this is about simplicity, is how we can spread the word and change the world. Mind, emotions, and body. Mind, emotions, and body with a conscious component and a subconscious component. And the physical body is voluntary, like I want to open my hands and close them, but it's also automatic responses, autonomic nervous system, like the heart rate and the breathing and the saliva production. Mind, body, emotions. Okay? So path forward, and this is what I teach patients too. It's the same model I said at the beginning, same model for patients, for families, for healthcare and wellness professionals, the same model for everyone. It's just different levels of complexity and language depending on their capacity to understand medical terms or to keep it to popular language. This is a lot of complex fields that we're making simple. We're going to study this in simpler terms over the next few weeks, a lot of fields and a lot of nervous system processes, but we're going to keep it simple. Okay?